Thank you. Thank you so much for having us. I am going to do my best to keep an eye on the chat and if questions come in otherwise, so we can have a discussion as we go. So please, talk to us as we go through, and I will do my best to answer your questions. If I can't answer them, Sherry is here to help me out. And if you could bring up the slides, that would be fantastic. And we can start here. We can start with this one. Just as an overview, a little bit of an introduction into our agency. We are the Community Services Board, and Virginia has about 40 of those total. But we are also the Area Agency on Aging, and there are 27 of those in the state. We're unique because we're the only combined agency. That means we're pretty large. We have just over 400 employees. We cover a large area. We are planning District 9, so we cover the counties of Fauquier, Madison, Orange, Rappahannock, and Culpeper. And we are, by statute, the single point of entry into publicly funded mental health, substance use services, and intellectual and developmental disability services. You can go to the next slide, please. I always bring our mission and vision when I give any kind of presentation. And in a nutshell, our agency wants people to live happier, healthier lives in their community. We want them to live as independently as possible with the least restriction in their activities. And all of our staff work every day to try to make this happen. Next slide. So a little bit of background on Medicaid before we go into what the bill says and what the potential changes mean. As you know, Medicaid is public health insurance program. It provides insurance for those in need. It's low-income adults, working families, certain seniors, and people with disabilities. It's a joint program between the federal and state governments, and it is federally funded, but it is state run. There are two different ways Medicaid is funded. If we're talking about conventional Medicaid, it's a 50-50 split in Virginia between federal funding and state funding. If we're talking about Medicaid expansion, the funding is a 90-10 split. That was enacted as a way to sort of sweeten this pot for states to expand Medicaid under the ACA. Something to keep in mind is that Virginia has what we call a trigger law. And that says if the federal government reduces the amount they are contributing to Virginia, then Medicaid expansion in Virginia ends. It's a very broad application because there's no number on how much it would have to just decrease. It just says if the federal government decreases the amount they're contributing. That's very important to us at ECS because Medicaid is the largest source of funding for mental health and substance use disorder. We also will talk about how in the bill, some of the funding is starting to switch from categorical grants to block grants. And so if you have a categorical grant and you have a state and federal match, then as your need increases, theoretically, the federal government will still keep matching to meet this need. Under a block grant, you get X amount of dollars, and that is the money that you can spend. The money does not increase if your need increases. And then I also put on here just some numbers about who is covered by Medicaid. Prior to expansion, it was only open to aged, blind, disabled, and parents making less than $12,000 per year. Expansion really opened the program to all eligible adults. And so currently, Medicaid covers 1 in 5 in Virginia, 2 out of 5 births. That's even higher in a rural area. In a rural area, Medicaid's paying for half of all births. 3 out of 5 nursing facility residents. And Virginia has comprehensive coverage. So Virginia covers mental health, long-term support. There are a lot of things rolled in and included in Virginia that other states don't cover. You can go to the next slide, please. The other thing we talk about is how Medicare and Medicaid Medicaid work together. And often we'll have populations that don't quite meet income eligibility, and maybe Medicare can help fill some of those gaps, but also Medicare has limitations on coverage. Medicare does not cover nursing home care. It does not cover a lot of in-home care and community support in a way that Medicaid does. Um, we know that 1 in 4, so about 25% of those that are enrolled in Medicaid are either over the age of 65 or they have a disability. The funding is also skewed toward older adults. More than half of the budget is spent on those over 65 or those that have a disability. I think that a great thing also that Medicaid does is it supports caregivers. So it offers that respite care, which really gives a much needed break to those providing care. We can go to the next slide. And the Medicaid waivers really help children and adults with disabilities get the care that they need to live safely at home. If a child or an adult loses that waiver, the impact can be devastating, both to the client and to the family. You're facing caregiver burnout, you're facing financial struggles. Waivers provide individuals those supports to live in the community surrounded by people that love and know them best. And there's a list on there. I think this group's probably well versed in all the different things that a Medicaid waiver can provide. They're designed for those individuals that meet criteria for care in a facility, but instead receive services at home in their community. We can go to the next slide. And this is just an example, and I've got Sherry to weigh in on any details on these waivers. But these are the types of waivers we, as the Community Services Board, are the entry point for a DD waiver. There are over 13,000 on the wait list in the state of Virginia. About 380 of those on the wait list reside in our service area. There are the 3 different types of waivers that are mentioned on the slide: the building independence, the family and individual support, and then the community living waiver. Medicaid also offers the CCC Plus waiver, but we are not the point of entry for that program. So what's in the bill and what does it mean? Last week, Congress passed the largest federal healthcare cuts in US history. That's the bottom line. And this represents a significant change in our healthcare system. The full impact of this will unfold over time, but we, as both the CSB and the Area Agency on Aging, we are squarely in the path of the impact of this bill. Medicaid, although federally funded, is state managed. And so states are going to have to make some really hard decisions about how to spend these dollars. So on the left side, I have provisions that are in HR 1, and on the right, I have potential impacts from this bill. So the biggest impact is money. There are approximately $900 billion in Medicaid cuts. And so that means there's potentially less funding for things like a waiver. There are a lot of work and education requirements, and those are going to roll in. What those have done generally when this has been applied in other states is clients have lost their Medicaid because they haven't kept up with the paperwork requirement. It's cumbersome. It's a burden on both the client, it's a burden on the social services agency. And so this bill has changed the requirement from 1 year to every 6 months. So it means that all of our clients are going to have to try to be very careful about keeping up with things that come in the mail and reminders and submitting all the paperwork. It's an administrative burden designed really to bump people off the rolls, not because it's a cut, but because it's an administrative issue. There will be copays associated now with Medicaid that weren't there before, which means that there's potentially increased cost. And for a lot of our clients, that's a barrier to care. If you have a very low income and your choice is paying a copay at an urgent care or buying your groceries, those are choices that we don't want families to have to make. There are reduced provider taxes, and those taxes were disproportionately assigned to states that have expanded Medicaid. And what that does is it limits state Medicaid revenue because you're losing federal match. And what's in the bill is coverage loss because of the tightened eligibility. We can go to the next slide. So what does it mean for the waivers that we have in Virginia? I think if you remember nothing else that I say today, it's that all of this is going to change and it's going to keep changing, and we're going to do our best to keep up with it. In the bill, the only thing that was immediate, the only action that starts right away are the tax cuts. All of these other changes and funding reductions are rolled in over time. And they have varying start dates, and it's really challenging to keep up with it. But many of them don't start until 2026. What we're worried about are things like a cap. So, as the funding changes, and if it changes from a categorical to a block grant, then we have less money to work with, and we're worried that that the state might decide to put a cap on a certain type of service. There could be service limitations. If they're looking at the overall big picture, they have to decide what to keep and what might go. And just as an example, under aging services, some things were just simply lined out, like the chronic disease self management lined out. Alzheimer's support got a 50% cut. So we don't know how this applies yet in this topic area, but we're going to keep a close eye on it. The eligibility, the criteria will probably change because if you've got less money, generally the first reaction is to tighten eligibility. So you just have a smaller pool that you need to manage. And then we talked about the administrative barriers, the paperwork, the verification, the work requirements. All of these are access barriers to care. I think too, we have to talk about, and it's probably in a later slide, but the ripple effects that come with these things. If you have a child that's on a waiver and you're able to still go to work because of this waiver, what happens if either the time that you are allotted for care goes down, or if it's the worst case scenario and someone loses a waiver, then the person who is employed and going to work may have this difficult choice to face about what comes next and what works for their family. So these aren't these all of these changes have ripple effects in our community. We can go to the next slide. What can you do? What can you do today because one of the greatest tools that the administration has right now is uncertainty. Uncertainty is hard to live with. It's difficult to manage. So the best thing that we can do is stay informed. Track any official notices you get, keep them, save copies of your service plans, save communications with your providers and care coordinators, and sign up for updates. So any of the three listed there, if you want the updates that are coming from Encompass, you just go to our website, encompasscommunitysupports.org. There's a button at the top. I think it says join our mailing list or join our email list. Click that button, put in your email address, and you will get any updates that come from our agency. Next slide. These are all numbers and websites that will be useful to have as contacts as we navigate this changing landscape. One thing that I didn't talk about, it's in my slide when I talk about older adults, but I think before I talk about this Supreme Court decision, I want to make sure that I mention the impact of Medicaid on hospitals and how they're so closely tied, and the amount of funding that hospitals get from Medicaid. And especially in a rural area, hospitals already operate on sort of a thin margin and struggle to keep their doors open. When we talk about these cuts to Medicaid, there was an analysis done, and across the country, it identified hospitals that were at risk of closure if these cuts went into place. And Virginia has about 8 or 9 hospitals that are at risk of closing if these Medicaid cuts go forward, and 7 of those were considered to be at imminent risk. Most of them are either in Southwest Virginia with Ballad Health or along that bottom border in the state of Virginia, close to the Tennessee line. But this is something that we all have to keep talking about, because cuts to Medicaid cuts to Medicaid impact everyone. If your hospital closes, you've lost one of your largest employers in a rural town. If a hospital loses funding, they have to make the same decisions about potentially
Yep.
reducing services. And if that happens, that means wait times for everybody increases. If folks don't have Medicaid in a community, they lose access to get primary care or urgent care at another location. They're more likely to go to an emergency room for care. So, all of these things are important to think about and talk about related to this bill. The slide in front of you, we added, it's a Supreme Court decision that essentially says public entities must provide community based services to persons with disabilities when the services are appropriate, when the client does not oppose this community based treatment, and when this can be reasonably accommodated. This will become important, I think, as folks are at risk of either not getting qualified or at risk of losing a waiver. It's something that you could use in an appeal. And we can go to the next slide. Our goal at ECS is to connect people to the resources that they need, whether it is counseling, prevention, crisis intervention, DD waivers. We want to build a stronger, healthier community. And one of the ways we're trying to do that is provide sort of a no wrong door access. And we have a position that is a community navigator. It could be considered a single point of entry so that if the person doesn't know who to call or has called and hasn't received an answer or somewhere along the way on a wait list and wants an update, you can reach out to this navigator and they will help connect you with the appropriate person in our agency. We have 5 counties and 400 employees, so there's a lot happening, and this can act as sort of a single point of entry for anyone struggling to navigate the system. And we can go to the next slide. Advocacy works. And I think we have seen some of this happening through this bill process. We were able to keep some of the funding related to the Older Americans Act together under one umbrella. And a lot of these changes do not go into effect until after the midterm elections. So if you are interested in continuing these conversations and talking with your legislators, you can scan that QR code, put in your address, and it will provide a list for you of your elected officials. Something that we are doing at Encompass as an agency is we continue to advocate for a budget that works for everyone. We are sending updates. We're going to town halls. We're meeting with our legislators. We're doing anything that we can to make a difference for our community. And next slide. Those were all of the slides that I brought to sort of open up our conversation and say what we knew at this point in time. And I think we can open it up for any questions or discussion. And I'll also defer to Sherry if I left something out that was important to say. Please jump in and let us know.